This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, good morning, everyone. So I want to talk about something that's near and dear to our heart in the ER, and that's chest pain patients. This is something obviously we see all day, every day, and I just wanted to give you a little insight into what we as providers, kind of how we risk stratify these patients on, who can go home, who needs to be admitted, who needs to go more emergently to get a further workup. Back in 2008, they came up with this great algorithm and paper called the HEART score. And the idea was they were trying to predict what your 6-week chance of having a major adverse cardiac event was. So that includes any sort of MI, any sort of Cath procedure or PCI, and getting a CABG and or death. And what they did was they came up with this beautiful algorithm called HEART. And so I'm just going to go through each one. H stands for history. And in chest pain, history really matters. So there's kind of 4 questions that I think really are kind of pertinent to ask at a chest pain patient. One is, were they diaphoretic with their chest pain? Were they sweating with it? Number 2, did they have vomiting and or nausea? Number 3, did it radiate down the left or right arm? And then number 4, was it exertional? So if you get one of those, you get 1 point, and then greater than 1, you get 2 points. The next is EKG. So there's very specific EKG changes we're looking for to get points on this. So do they have any left ventricular hypertrophy? Do they have any T-wave inversions or any new bundle branches? They do not get a point if they have any AV, first degree AV block. They do not get it for benign early repolarization. That's young, healthy people we see. And then they do not get it for any QT-prolongation. And then you get 2 points if you have any ST depression. And then the third is for the A is for age. So if you're over 65, you get 2 points. If you're 45 to 65 or 64, you get a point. And then less than 45, you get 0 points. And then R is risk factors. So it's all your classic, hypertension, hypercholesterolemia, diabetes, obesity, family history, smoking, any previous MI, any previous CABG, if you had a stroke or any peripheral artery disease. And then last is T for troponin. So obviously if it's not elevated, you get 0. If it's 1 to 3 times, you get 1 point. And then greater than 3 times the upper limit, you get 2 points. So that gives you a score between 0 and 10. And then this is where the kind of scale is pretty useful. If you're 0 to 3 points, these people have, in the next 6 weeks, a chance of having a major adverse cardiac event of about 2%, depending on the study you look at. So these people go home. So this is your young, healthy person that doesn't have any risk factors, doesn't smoke, has a normal EKG, normal trope. We send these home because we accept this kind of 2% risk of them having an adverse event in the next 6 weeks. And then you have the 4 to 6. These are kind of your in-betweeners. These people have about a 20% chance of having some sort of adverse cardiac event in the next 6 weeks. So they should either get admitted for a stress test or if they're Kaiser, they should follow up expedited outpatient to either get a stress test or an echo or both. And then your 7 to 10 points, these are super high risk. There's a 72% chance of having an adverse event. So these all get admitted, called cardiology, and they usually get Cath pretty soon as an inpatient. Obviously, you have to use some clinical discult, but this is a good way to put people in distinct categories that's supported by a lot of evidence. It's also nice to put it in your note because it's backed up by a lot of evidence. If you want to send someone home, you can justify it. Or if you want to convince the cardiologist or the hospitalist, you can also give that same number, and works pretty well. That's all I have. Let's have a good day.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.